Hello, and welcome to our next episode of Live and On Call with Lake Charles Memorial. My name is Allie, and I will be your host today, fielding questions about diabetic foot care. I'll be asking a few of my own, so don't be afraid to submit your questions below, and we will get to those questions as soon as we're done with our discussion with our guests today. If you like today's episode and you would like to find recordings of any of our past topics, including women's health, mental health, colorectal cancer, and so much more. All of those past videos can be found at lcmh.com/video. You can log into our website and see any of those past episodes talking about different relevant health information to keep you and your family healthy. If this is your first time joining us, here's what to expect. We'll start with a discussion about today's topic, and then we'll move into some Q&A. So we're all here to learn. Don't be afraid to ask questions during the live stream, and while we're speaking with our guests, you may put your questions in the comment section below. Or if you'd prefer, we'll be monitoring our direct messages as well. If you'd like to submit an anonymous question, you're totally welcome to do that. Feel free to drop any of your questions or comments below, and we'll get to them later. So here's a little bit about our guest today. Dr. Daniel T. Hall IV, he's the co-owner and co-founder of Louisiana Foot and Ankle Specialists. He, alongside his wife and business partner, Dr. Mallory Przybylski, began their practice in 2014 here in Lake Charles. He is double board certified by the American Board of Foot and Ankle Surgery and the American Board of Podiatric Medicine. He is the immediate past surgery department chairman and chief of surgery at Lake Charles Memorial Hospital. He is also the current medical staff president and active member of the board of directors of Lake Charles Memorial Hospital. And Dr. Hall is a dear friend of Memorial, and we are so grateful to have him today to share with us his expertise in diabetic foot care. Dr. Hall, I will bring you up just a second. How are you? Can you hear me?
Hello, thank you for having me.
Absolutely. Thanks for joining us. So before we get started, we are talking about diabetic foot care. And today is this month is National Diabetes Month, but today is World Diabetes Day. So it couldn't have been more fitting that we were here talking about this subject. So thank you again.
Absolutely, absolutely. Happy to be here.
So to kick us off, do you mind sharing a little bit about your background, what brought you to this particular specialty, and maybe what brought you to Lake Charles?
Yeah, so I grew up in Evansville, Indiana, so I'm certainly a transplant. I remember my first few weeks and months here practicing. I was butchering a lot of Southern Cajun names, so they've certainly welcomed me with open arms. But yeah, so me and my wife, we both graduated residency in 2014, and we knew private practice was something we certainly wanted to do, and we ended up finding and purchasing a practice here in Lake Charles from a provider that was retiring, and it's been a blessing, and we're certainly happy to be here.
And how do you like the food here better than your home?
I put on about 20, 25 pounds since we got here, so I'd say it's pretty good. I'd say it's pretty good. No, everything around Lake Charles and in Southwest Louisiana has been absolutely amazing. So we're certainly happy to be a part of the community, without question.
Awesome. Well, for those of you listening, just a reminder, if you have any questions during our discussion, please place them in the comment section below or send us a message, and we'll go ahead and get started with today's topic. So like I mentioned, today is World Diabetes Day, and diabetes can pose threats to many parts of the body for a patient, but one important risk to pay attention to is a patient's feet. How are these two related, Dr. Hall?
So, diabetes, as most of us know, is a disease process characterized by abnormally high levels of blood sugar or blood glucose. And when you have these abnormally high levels, it can actually cause permanent nerve damage in the feet as well as damage to the blood vessels or arteries. So, when a patient has damaged nerves, or what we call diabetic neuropathy, they end up experiencing, numbness, tingling, burning, but the most catastrophic thing of diabetic neuropathy is the loss of protective sensation. So patients can actually step on, a nail or a rock or something and not feel that. So when you do have diabetic neuropathy and loss of protective sensation, you can ultimately develop a nick or a cut that ends up developing into an open wound, and the bottom of the feet where germs and bacteria exist is an easy portal for infection to develop. Carry on to diabetic peripheral angiopathy, or damage to the blood vessels. There's not blood flow to heal. Whether it's antibiotics or medicine we take, it's all delivered through our bloodstream. So if a patient does happen to develop an infection, the antibiotics are not appropriately able to treat that infection, and then you lead to tissue death, and ultimately can result with some pretty catastrophic complications, including amputation, which is a pretty common thing that we see, unfortunately, with our diabetic population.
Gotcha. So, in what capacity do you work with patients living with diabetes?
Oh man, so we see a variety of ailments, from simple ingrown toenails to skin lesions to complex foot and ankle reconstruction. But one of the most common reasons patients come to our office is for complications, or potential complications related to diabetes. So when it comes to the realm or gambit of the things we treat, it can be as simple as preventative or routine nail care, callus trimming, to advanced wound care, skin grafts, to management of peripheral neuropathy or peripheral vascular disease, to reconstructive foot and ankle surgery, to deformity created by diabetes, including limb salvage and, unfortunately, amputation. So there is a lot that we do with patients with diabetes.
Gotcha. And so, should every diabetic patient maybe be established with a podiatrist?
Well, I tell you this, currently 1 in 7 Americans suffer from diabetes. So that equates to about 51 million people. And we see, or projections of that number in 2025, so 3 years from now, we expect that number to balloon to 57 million. Fast forward to 2030, we expect that number to balloon to 65 million people. So this is an epidemic in plain sight. The worst part about this epidemic is that 1 in 4 patients that have diabetes don't know they have it. So when a patient does go to their primary care doctor or urgent care or hospital, heaven forbid, and they're given that diagnosis of diabetes, they likely have been diabetic for several months, if not years, prior to that diagnosis. So these patients may already have symptoms of peripheral neuropathy or poor blood flow. And an interesting statistic that came out, that was published by the Diabetic Foot Association, is that just having a podiatrist on your healthcare team helps minimize risk of amputation up to 70%. So would the answer be, does every patient with diabetes need a podiatrist? Well, I think it's important to establish with a podiatrist. I've got some patients that I see once a year. I've got some patients that I see once a week, just depending on the severity of their complications with the disease process.
Gotcha. So, what I'm hearing you say is make sure that you have Dr. Hall on speed dial just in case.
Hey, I'm here for y'all. I'm here for you guys.
Okay, so those of you, I see there's a few people joining us right now. And so, just a reminder, if you have any questions during the course of this conversation with Dr. Hall, please feel free to put them in the comment section below or send us a message, and we will be getting to those questions in just a little while. That's what Dr. Hall is here for. He's live and on call for you, answering any questions. So, let's keep moving through some questions I have. Can you tell me about some key factors that someone needs to look out for when they're, keeping check with their feet and making sure that everything's okay as a diabetic patient?
Yeah, so if you are dealing or suffering from diabetes, the three big things I tell patients to look out for is, one, look at your feet for any deformities. Do you have the start of bunions or hammer toes or crooked toes? Anything that could create wearing a regular shoe more difficult. I'll probably see once a week patients come in with new onset blistering, or heaven forbid a cut or a bruise or something due related to ill-fitting shoes because of their deformity. And there's a common myth that exists that, oh, if you're diabetic you can't have surgery. Well, that's not the case. Uncontrolled diabetic patients have an increased risk of complications, but controlled diabetics will certainly do as well as non-diabetics if they control their sugar. Number two is to look at hair growth. 10, 20, 30 years ago, you might have had a lot more hair on your feet and legs than you do now. That could be an early sign of either poor circulation or early neuropathy related to the diabetes. And then lastly is skin temperature and skin color. If you see that, hey, your feet used to be, white or black, and now they're a lot darker or blue in color, or they're warm or cold to touch, that also could be a sign of a pretty significant disease process that takes form. Either way, when you leave our office, you're going to hear the same thing: is go to the convenience store, buy a cheap handheld mirror, put it on the nightstand, and check your feet every night before bed. It is a 10-second step that every patient should employ that can prevent some pretty significant complications.
Yeah, I mean, it could be easily be something you just never think about. And so I could see how something could go without noticing, especially if you're having, nerve damage and not able to feel your feet
No, the
like you would
foot is one of
normally.
the most neglected parts of the human body. We kind of take for granted until you sprain that ankle or until you hurt that big toe or something, and then you realize just how important your feet are.
Gotcha. So you mentioned, the first thing, the most important thing is to check your feet. You know your feet better than anybody, but what else can we do to avoid experiencing some of these common foot issues?
So the one thing is to check your shoes. A lot of times there's rocks and dirt and things that those that can feel can easily know something's not right. But when you can't feel your feet, I have more sad stories than I care to share about patients that have had a rock or a pebble or something inside their shoe that they didn't know, that ultimately resulted in an infection that, found them in the hospital. So checking your shoes is one. Two, you know, making sure that you're replacing your shoes every 6 to 8 months. Shoes typically will wear out after about 200 to 300 miles, give or take. And I see patients all the time that, hey, these shoes look brand new, but they're 7 years old. They've lost all support for that foot. So supportive shoe gear, making sure we're changing out our shoes, making sure we're wearing appropriately sized shoes. Allie, I'll ask you a question. When's the last time you measured your foot?
Um, Never.
So we go to the shoe store when we're 12 or 13 years old, and that's the same size shoe we just wear. And as we get older, hey, our tendons and ligaments become a little more taut, our foot gets wider, our foot gets longer. So our foot size actually changes. Our bones aren't getting longer. It's just the supporting structures actually make our foot wider or longer. So patients oftentimes will come in that aren't diabetic, that have the worst foot pain ever. Hey, we put them on the Brannick device, which is what measures your foot size, and lo and behold, they're wearing a shoe that's, a size or size and a half smaller. Well, I've always worn a size 12, Dr. Hall. Well, your foot hasn't always been that size. So making sure you're wearing the appropriate size shoe is just as important. And also making sure we're wearing appropriately sized socks, not wearing socks that are too tight, that cause your toes to scrunch up. Those are really important things that we can do. Shoes are our best defense as far as protecting our feet from injury. And it's something that we oftentimes overlook or take for granted, or just throw a pair of quick shoes on and we run out. The other thing is to avoid barefoot walking, particularly outside. I cannot tell you how many times I've seen patients in the emergency room, in the hospital, on my OR table, that have succumbed to infection because they were simply walking barefoot. So making sure we're always wearing something that's protecting our feet is also another extremely important point.
So, just a follow-up question to that about shoe size, circling back to that. So, sometimes patients, their feet can swell a little bit more. And so, would you take that into consideration when you're choosing a shoe size, that you would want maybe a bigger shoe size based on that swelling? Or does
Well,
that kind
yeah,
of help?
definitely. I think take into account one, let's figure out why you're experiencing swelling. Is it because of high blood pressure? Is it, diabetic related, renal insufficiency or kidney issues? So making sure we're on the appropriate medication and making sure that we ruled out any peripheral vascular disease or complications to at least get to the root of why we're having that swelling. One. Two, if a patient is diabetic and does suffer from peripheral neuropathy, and they say they have a hammer toe or a bunion or some type of pedal deformity, getting them into a custom diabetic shoe is a very popular option that's well covered by nearly every insurance plan or carrier. You just have to, one, meet the criteria from, the foot and ankle standpoint and have to be managed for your diabetes by, a primary care physician or endocrinologist or internal medicine physician.
Gotcha. So, how do you know when it's time to see a podiatrist? How do I know when it's time to call Dr. Hall?
Well, again, when it comes to diabetes related issues, I think every patient that gets that bad news that, Allie or whomever you are a type 2 diabetic. I think it is imperative to take the initiative to get a board certified podiatrist on your healthcare team. I see new patients all the time that were recently diagnosed with diabetes and they come in saying, "Oh my God, this is the end of the world. I'm going to lose my foot." And I say, well, no, your blood flow is excellent. Your peripheral, sensation is intact. I see you once a year for a follow up or even as needed. But the best thing you can do is actually schedule that appointment with one of us and we can go over, hey, you've got this, and this that are really, really good, or you've got this, and this that really need some attention and we need to get you into, custom shoe gear or get your referral to, a cardiologist or a neurologist or whatever the case may be to help minimize any risk of further damage or destruction.
Gotcha. So, um, also, I wanted to ask you, what's some of your advice for caring for loved ones? Maybe loved ones who are a little slow to ask for help. Maybe they're not paying attention to their feet, but it's someone we care about, maybe a spouse or a parent or that kind of thing. What's your best
Oh, that's a good
advice?
question. It would be getting people to actually buy in. We only get one life to live. And, I don't know about you guys or anyone listening to this, but I want to live as long as possible. And I think the one thing or encouragement you can do is, hey, just remind them to check their blood sugar. There is a very cool device that's been on the market, openly for the past, 5 to 7 years. And it's called a CGM or continuous glucose monitoring system. And it's a patch that you wear, on your arm or on your abdomen. And on your smartphone, it gives you your blood sugar real time. I find the number one reason patients don't check their sugar is not because they're lazy or they don't want to. It's they don't want to keep pricking their finger. Or, hey, my insurance won't approve any more strips. Or, my glucometer is out of batteries or not working and the insurance won't pay for another one. So just finding ways to make it easier for them to check their blood sugar. And again, I mean, keeping your A1C or the 3 month blood test under a controlled level will decrease so many comorbidities that are associated with diabetes. And lastly, diet. I mean, listen, I already told you when we first started, I put on weight since I got here. I'll be the first to admit it. The food here is fantastic and wonderful. And in portion control and really get on a plan is certainly going to be important to help those that are suffering from diabetes, live a long and fruitful life.
Yeah, if there's one place that's hard to be a type 2 diabetic, it's going to be in Louisiana where we have rice with every meal.
Most definitely. It's a food group down here.
Right, yeah, exactly.
Absolutely.
So, we do have a comment question real quick. And again, if anybody else is watching that has any questions for Dr. Hall, feel free to put them in the comments and or send us a message. But
Yeah.
we have one question here. It says, I'm borderline diabetic and I have tender heels, especially when I get up in the morning. What could be done for this?
So pain with first step in the morning is probably related to inflammation of the ligament that runs along the bottom of the foot called the plantar fascia, plantar fasciitis. So things that you can immediately do at home is you can begin a stretching regimen, change out your shoes or at least evaluate your shoes and see if they're worn or time for another pair. Barefoot walking in the house is another very common thing that we all do here. And with mostly hardwood floors or tile floors here in the South because of hurricanes and such, It's something that we see a lot of heel pain or foot pain for. Anti-inflammatories, if you can take those types of medications, and if none of those things seem to work out or benefit you, give me a call. I'll be happy to help out and check out and see what's going on and help you get out of that heel pain. That's a great question. Great question.
Awesome. So let's see. I'm waiting just a second just to make sure there's no more questions that we have coming in. Is there anything else that maybe we didn't touch on,
You
Dr.
know,
Hall, that you want to say?
I do want to discuss, diabetes is an epidemic. 931,000 people died last year from diabetes related complications. And I have the privilege of working at the wound care center here at the hospital, and there are currently 13 million Americans with diabetic foot wounds. And Allie, just the presence of a diabetic foot ulcer, just the presence, you have a 25% chance of an amputation.
Wow.
25%, one in four are going to result in an amputation. What's worse is 50% of those 13 million people with a diabetic foot wound are going to end up hospitalized at some point in time with an infection related to that diabetic wound. Furthermore, if you end up in the hospital from that infection from that wound, you have a 50% chance of undergoing an amputation if you're hospitalized with a diabetic foot ulcer. And if you undergo an amputation, you have a 50% chance of undergoing a further amputation within 2 years. I'll give it to you like this.
Wow.
If you undergo a below knee or a below knee amputation, excuse me, an above knee or a below knee amputation, those are considered major amputations when it comes to the lower extremity. A toe amputation or a midfoot amputation or partial ray amputation, we call those minor amputations. So those are the difference. So a minor amputation, well, how the hell can I end up with an amputation 50% in 2 years if I already lost my leg? That's a major amputation. I'm talking about minor amputations in which you can end up with that category. But here's the thing, if you end up with a below knee amputation or an above knee amputation within 5 years, you have a 78% chance of not being with us in 2027. 78% mortality is associated with a below knee or an above knee amputation. So when you compare that to cancer, patients that are diabetic that undergo a major amputation have a much higher mortality. It only comes to second to lung cancer. So this is truly an astonishing epidemic that is happening in plain sight, and it's something that's very near and dear to me because I think oftentimes it doesn't garner the attention or the respect in mainstream culture or media. But this is a disease process that for instance, Ali, last year the healthcare system in the United States spent over $400 billion on diabetes related healthcare. And as we see the numbers that are going to be increasing staggerly over the next 5 or 10 years, this is putting such a strain on our healthcare system. So, what can we do to mitigate that? Well, it's early intervention. It's, hey, when you get that diagnosis, seek out a care from your primary care, seek out care from a board certified podiatrist, seek out care from a retinal specialist or an eye specialist to ensure you're not having any complications with your vision as well. But we've got to intervene much, much earlier. My wife always says you need to be proactive rather than reactive. And that
Right.
is what we need to do with this disease process to get this under control because it is a rampant epidemic that is happening before our very eyes that garners very little attention. So programs like yours, Ali, bringing attention to, the Diabetes Awareness Month is just so important for us to get this problem under control.
Yeah, definitely. I mean, you think of it, oh, I'm having foot problems because of my diabetes or whatever, and you don't think much of it. But when you put it in that perspective, it really is a life or death situation that it could mean it's a life or death situation.
Yeah, it's tough
Or
conversations to have. Every time a patient comes to me with a new patient with a wound or something, I give them those statistics like, hey, This is nothing to sneeze at. This is very serious. And in many cases, with just compliance and good blood sugar control, we can get ahead of this. That is the benefit of this, is that this is treatable and manageable with a good comprehensive approach from your primary care physician, your endocrinologist if necessary, your podiatrist, your cardiologist, your neurologist. I mean, it is a multifaceted approach to approach this disease process. And we have every specialty that I mentioned on staff at Lake Charles Memorial Hospital. So we have every specialty necessary to get you the help you need.
Exactly. Now we do have one more question that came in, and I'm not sure. I'm not sure if this is something that you would want to refer them, back to their primary care or somebody else, but maybe you have some thoughts on it. It
Sure.
says, what are the best? What are the best artificial sweeteners to use? You have any thoughts on that?
So I have mixed feelings about artificial sweeteners, because even though it doesn't say sugar on your packet, once your body metabolizes them, it metabolizes them basically into sugar. So yes, is it a healthier option than, regular table sugar? Yeah, sure it is. But the aspartates and some of those other chemicals that make artificial sweeteners, I do have some reservations with that. I will certainly refer to my dietitians for a much more thorough preview, but please don't think that artificial sweeteners are a substitute for you to go crazy with because it doesn't say sugar on the packet. That is absolutely not the case.
Gotcha. Well, if any of you guys watching have any more questions, feel free to go ahead and leave them in the comments below. And after the live stream is over, I don't mind sending them over to Dr. Hall, and we can reply back from the
Definitely. I'll
Facebook
be
page.
happy to answer any and all questions you guys have for sure.
Cool. Well, thanks again for visiting with me and taking the time today to touch on this very important topic and share this expertise with the community. It really is a gift to have you here and to have you as a friend of Lake Charles Memorial. We really appreciate everything you do. And I think the one thing I'm going to take with me from this discussion is that diabetic foot care is not anything to play with. It's not anything to overlook, that it is very important and it could mean life or death in some cases. And so that's something I'll take with me and for my loved ones as well. So thank you.
No, you're certainly welcome. And if you guys have any questions or want to schedule an appointment, you can go to our website at lafootanklesurgeons.com, and there's an online appointment request that you can make, or you can call that phone number on the screen. And we look forward to seeing you for sure.
All right. Is there anything else you want to mention about different conditions you treat or different type of patients that you see besides?
Yeah, so we see patients of all ages. My youngest patient is 4 weeks old, and my oldest patient is 104 years old. So we see a litany from, like I said, simple ingrown toenails and skin lesions all the way to, complex, foot and ankle reconstructive surgery and anything in between. So if you are having any problems with your feet, small or large, please call our office or visit our website, and we'd be happy to make those feet feel better.
All right. If that's not your slogan, it really needs to be. Make your feet feel better.
I like that. It actually just came to me. So I really appreciate the time and the opportunity, Ali, for this discussion. I think it's so important, and I could go on and on and on about diabetic related health and foot care. It's something very near and dear to my heart, and yeah, I look forward to getting this epidemic under control one foot at a time.
All righty. Okay, well, thank you. And we will see you guys next time for our next episode of Live and On Call.
Take
Have a
care, guys.